Gold FM, only the classic hits. I'm Bulavanaka in Fiji, and welcome to another segment of Speak Your Mind. I'm your host for today, Dion Davu, and in studio with us, we have the Executive Director of the Rainbow Pride Foundation, Mr. Isikeli Vulovo. Bulavanaka, Mr. Vulovo, and thank you for taking the time out to come and be with us today on Speak Your Mind.
Bulavanaka, Dion.
We hope you managed to, take time of it. We certainly thank you for taking time out of your busy schedule to be with us. And yes, today, we'll be elaborating a bit more on the World AIDS Day, which is scheduled for Thursday, the 1st of December. That's this week. Now, basically, Isikeli, to start off, can you just give us a little bit more on what exactly is the Rainbow Pride Foundation?
The Rainbow Pride Foundation is an LGBTQI, a lesbian, gay, bisexual, transgender, and intersex organization in Fiji that is led by people from the community. And it works in the areas of human rights, promoting LGBTI rights and equality, and also promoting social justice, as well as in the area of health and well-being, particularly on HIV and AIDS prevention.
Now, has the Rainbow Pride Foundation been operating in Fiji for quite some time, or is this a new development?
We actually started off as an unregistered network in 2009, and it was called Men Fiji at that time. And over the years, our mandate and our membership sort of expanded from just gay men and transgender to include the broader rainbow community, which includes lesbian, gay, bisexual, and transgender peoples in Fiji. So in 2014, we were officially registered as the Rainbow Pride Foundation.
That's very interesting, Isikeli. And moving on with our questions for the day, seeing as World AIDS Day is this Thursday, the 1st of December, what is basically HIV and AIDS for those of our listeners who are not in the know, so to speak?
HIV is the virus that causes HIV infection, and AIDS is the most advanced stage of HIV infection. And HIV is usually spread through various bodily fluids, and this includes blood, semen, pre-seminal fluid or pre-cum, rectal fluids, vaginal fluids, breast milk of an infected person, of a person that is infected with HIV. And also in other countries, this can be transmitted through injected drug users.
Would that mean by sharing needles and blood transfusions as well? That would certainly be ways of contracting HIV?
Yes, that's right. But in this region, in the Pacific and in Fiji, it's not that common for people HIV to be transmitted through those modes.
Going with the question, how can you as a person prevent HIV?
There are many ways in which you can prevent HIV. The common strategies that have been used in the past were the ABCs, which was abstinence. B stood for be faithful, and C was condomized. But this has now been expanded, and we are now promoting condom use as the main means of one preventing himself or herself from HIV. And there's also HIV testing. We are promoting HIV testing so that people are aware of their HIV status. And most people in Fiji, we know, they claim to be HIV negative, but actually they are HIV unaware, meaning that they haven't been to the clinic where they get tested to know their HIV status. So unless they have been tested, then they can, and the results come back negative, then they can boldly say that they are HIV negative. Otherwise, they are HIV unaware.
I see. So how have local attitudes changed in regards to HIV prevention and those living with HIV? Would you say that people would still have a certain how you say, reluctant to be around those who have contracted HIV, or has the attitudes changed locally over the years, or would it still be the same?
I think there's little change over the years, but there's still a lot of stigma and discrimination around HIV, particularly around people living with HIV and those who are affected by HIV. And this is one of the main reasons why people are afraid or are fearful of getting tested for HIV, because of the stigma and discrimination that is still associated with it. And just recently, a study was conducted in Fiji by the Ministry of Health, UNAIDS, and the Fiji Network of People Living with HIV. And the study was called the Stigma Index, where they spoke to people living with HIV to find out if they still faced a lot of stigma from the community. And the results maybe of that study can be shared by my colleague who will join us later.
I see. And moving on with our line of questioning, for those here in Fiji who are afflicted by HIV or AIDS, can they live a full life here in Fiji? Are the medication available to them? Is support available to them?
Oh yes, we are trying to destigmatize HIV, and we are doing that by promoting the treatment that is available. Now, people living with HIV, they can live long, productive lives. They can just be as healthy as someone who is HIV negative, provided they take the prescribed medication or treatment. So people should not be afraid to go for testing for HIV, because we now have treatment that can prolong your lives, and you can remain productive for as long as you try and remain healthy and live a healthy lifestyle.
And what options are available to those in Fiji suffering from HIV/AIDS? Are there options for counseling, treatment, and testing as well?
Yes, when someone goes for testing, they first receive what we call pre-test counseling before they actually go in for testing. And during that counseling, we try and destigmatize HIV as much as we can, so that the person feels confident and is not too fearful, to try and remove all the misconceptions surrounding HIV. And this should encourage them to go for HIV testing. And whatever the results, we will provide also post-test counseling. This is usually provided by the Ministry of Health hubs, or the HIV and STI testing hubs in the 3 divisions in Fiji. And treatment is readily available, and it is provided free by government, although it is expensive. The government of Fiji provides the treatment for free for those who are living with HIV, so no one really has any excuse of not accessing the treatment if they are diagnosed with HIV.
Well, thank you for that, Mr. Vulovo, Isikeli Vulovo, of course, of the Rainbow Pride Foundation, Fiji. We'll cut to a short commercial break before we get back once again on Speak Your Mind. Gold FM, only the classic hits. Mbuluvanaka, and welcome once again, Fiji, to our second segment of Speak Your Mind. I'm your host for the day, Dion Davu, and with us in studio, the Executive Director of the Rainbow Pride Foundation, Mr. Isikeli Vulovo. Mbuluvanaka, Mr. Vulovo, once again.
Again, Dion.
Yes, and elaborating, well, obviously, in our first segment, we were talking about HIV and AIDS in Fiji and the stigma surrounding that, and of course, options for treatment and counseling as well as testing. And to continue with our line of questioning, what segment of the population in Fiji is at risk of suffering from HIV or AIDS?
Okay, the HIV statistics in Fiji suggest that the HIV is prevalent within the heterosexual population. So most of the transmissions are through heterosexual sex. But globally, and also now nationally, in the new National Strategic Plan for HIV and AIDS, we've identified or aligned our strategic plan to the global knowledge on where HIV usually manifests itself, which is within MSM, or men who have sex with men, transgender populations, and sex workers. And also, part of the key populations are the intravenous drug users, but then, as I have mentioned before, we do not have many intravenous drug users in Fiji. So the current HIV response, as per the new strategic plan for HIV and AIDS in Fiji, is very focused on these key populations. And apart from these key populations, the focus is also on vulnerable populations, particularly among sexually active young people, and seafarers. Okay, so those are the two other vulnerable populations that have been identified under the new strategic plan that we need to focus our work on. And the Rainbow Pride, that's where the Rainbow Pride Foundation comes in, because we work with men who have sex with men and transgender people. So we try and empower them through our educational and awareness programs. And in our programs, our main focus is basically promoting condom use among these key populations, and them knowing their HIV status. And they can know their HIV status by going for testing. And this is something that we would like to promote also to all the listeners out there. If you know that you are part of the key populations, or if you know that you are sexually active, it's important for you to go for HIV testing. It's nothing to be fearful of, because we have treatment that is available that you can easily access, and you can live a happy, normal life just like anyone else if you have HIV. Okay, as long as you are on antiretroviral treatment.
And would you say that those segments of our population who are under risk, would it be because of their attitude towards HIV or AIDS, they fail to take precautions, or is it basically a carefree attitude towards sex which would lead them down the road to HIV?
Yeah, it's basically because of the sexual practice. For men who have sex with men, the highest risk is for HIV transmission, or for HIV to be transmitted from an infected person to another, is anal sex, and also vaginal sex, so where condoms are not used. So these are the highest risk sexual practices, and most of the HIV transmissions in Fiji is through sexual transmission, and not through blood transfusion, or parent or mother to child, or parent to child transmission. So it's through sexual intercourse that most of the HIV in Fiji is transmitted. And our message goes out to everyone who know that they are sexually active and they are not using any preventative methods, they're not using condoms, and they are not aware of their HIV status, and they think that the other person that they're having sex with is HIV negative or is not infected. That's part of the mental attitude that most of the people, especially young people in Fiji, think, and also within the key populations. And this often leads to people getting infected because they are ignorant, of the risks that they are exposing themselves to.
I see. And compared to the rest of the world, how is Fiji doing in terms of numbers in regards to HIV cases and AIDS cases? Are we improving? Has the numbers dropped? Have the numbers increased? Or would they pretty much following the world averages?
Yeah, globally, the HIV infection rate is sort of plateauing, it's sort of decreasing. And this is the reason many of the donors are also decreasing funding that is made available through the Global Fund to address HIV. But in Fiji, we are seeing an increase, and this could be due to an increase in HIV awareness or educational programs, and people are now more open or more confident to access testings, and them knowing their HIV test results or knowing their HIV status. So, and because we think that Fiji is at a low burning stage, because when we compare data or results from surveys that we have done before, and also even from the data that we get routinely from the health system, we see that the STI rates are very high. Okay, and STIs like syphilis, gonorrhea, they are transmitted because people are not using condoms. And HIV is also transmitted that way. So this means that a lot of people are exposing themselves to HIV. So it just needs for a person, an infected person, to infect someone from a network, like a sexual network, and then the other persons can go and infect other persons. And this is also one of the things that we that was highlighted in the studies that have been carried out in Fiji, that many people have multiple sexual partners. And this is why we are reiterating the message that people need to use condoms and also access the services and go for HIV and STI testing for them to know their HIV status.
Well, thank you for that, Mr. Vulovo. We'll cut to another break now. We thank you for your time here. This is Dion Davu for Speak Your Mind on Gold FM. Only the classic hits. We'll be back after the break. Gold FM, only the classic hits. Mbuluvanaka, and welcome back to Speak Your Mind. I'm your host for this segment, Dion Davu. And with us in studio, the Executive Director of the Rainbow Pride Foundation, Mr. Isikeli Vulovo. Mr. Vulovo, our final segment for the day. And continuing with our line of questioning, how important is it to know your HIV status if you have contracted the disease?
It is very important for people to know their HIV status so that we can put them on treatment straight away. And only when you're on treatment, then you can live a long, productive life. And this is the reason we are promoting testing vigorously through our programs, and also nationally through the Ministry of Health programs. We are planning to launch a national testing campaign where we're going to promote for people to access the testing services that are closest to them, and for them to try and know the HIV status, and for more people in Fiji to be HIV aware, okay, or basically knowing the HIV status, because the antiretroviral treatment, like I have mentioned before, is readily available, and government provides it now for free. So people should not have any excuse of not going for HIV testing. And I think we also need to move away from that mental attitude where we were fearful of HIV, because HIV is now treatable, and there's many people who have lived long lives living with HIV. So it's time for us not to be afraid or fearful anymore of HIV.
For listeners and our viewers as well who are tuned in right now, what options are available to them in order to go and get their testing done? Can they just walk into any doctor's office or any local doctor's surgery near them to get the HIV test done? And is it affordable for locals here in Fiji?
Yeah, HIV testing, I believe, is available in all the health facilities around the country. And they also have the hubs, which are like the main reproductive health clinics in the division. So they have one in Suva, opposite the old mortuary, and they also have one in Lotoka, and there's one in Lambasa. Okay, and these clinics, they specialize in HIV. So people can go to those clinics for testing, or they can even go to the closest health center. And if they can afford the private practitioners or the private doctors, then they can also ask for these services when they visit these clinics. So it's accessible now, because this is one of the main goals in the sustainable development goals, universal access to healthcare. So and that is what the government is doing with the support of civil societies like the Rainbow Pride Foundation, is making or bringing the services to the population, okay, to the communities, so they can access these services. And for HIV, basically knowing their HIV status.
I see. And coming up this Thursday, we've got World AIDS Day. Basically, what is World AIDS Day, Isikeli?
Okay, World AIDS Day is a day that is celebrated annually by every people around the world, um, dedicated to remembering those who have lost their lives through HIV and AIDS, and also the achievements, the successes that we had over the years to be where we are today. Okay, 30 years back, we were not where we are today. We now have treatment, modern or advanced treatment that can prolong people's lives. And before, people living with HIV had to take many pills, a cocktail of pills to keep them alive. But now it's just all compressed in one pill. So there's many advances that has been made, and there's still a lot of challenges for people that work in the area of HIV. So this day is a day when policymakers, people from all walks of life, come together to energize each other, and to map the way forward in trying to eliminate HIV by 2030. So that's the plan globally, for the world to be, for there to be zero HIV by 2030.
Well, that's a very wonderful plan there. And to my understanding, HIV and AIDS has no cure, but if you manage to get diagnosed early and you take the proper treatment, you'll be able to live a full and healthy life.
That's right.
I see.
Yes.
And what is this year's theme, and what does it mean for those people around the world living with AIDS and HIV?
Okay, this year's themes is hands up for HIV prevention, and this has been theme has been developed by UNAIDS, and this is something that they are promoting, to go for prevention. We shouldn't wait for people to get infected and then we focus on treatment, because treatment, like I have mentioned before, is expensive. So we should concentrate our efforts on HIV prevention. That's why we're promoting condoms. We're promoting people to know their HIV status, so that they know if they have HIV, they can be treated early. And also, there are many other ways in which people can prevent HIV by abstaining from sex, reducing their partners, and for the key populations, particularly for men who have sex with men, there are many other options available, including serosorting. Serosorting involves people, before having sex, they ask their partner if they have been tested for HIV, or when was the last time they had sex, did they use a condom. So that sort of discussions need to take place before people have sex. But as we all know, that people, we know, when they are very aroused, they forget about discussing all these key important issues. They just get into the business. So the focus now is on prevention. Okay, while at the same time, we are using treatment as prevention, meaning we want people who are living with HIV to be on treatment, because once they are on treatment, after 6 months of consistently taking the drugs on a daily basis, the levels of HIV in their blood becomes undetectable. So if they have sex, they will not be able to transmit the virus, even if they have been diagnosed with HIV, because the virus is now not in their blood, so it cannot be transmitted through the bodily fluids where HIV can be transmitted. The HIV virus had sort of migrated into their body cells, so they hide within the body cells because the medication or the medicine that is in the antiretroviral drugs are in their bloodstream.
Well, finally, reaching our last question for the day, Ezekiel, what are the national plans to celebrate World AIDS Day?
I believe that the Ministry of Health, they are organizing a national event in Lautoka on Thursday. So I think there's a march and and they have information booths that will be set up in Lautoka, and I think they will be setting up in Churchill Park. So we would like to strongly invite and strongly encourage the people who live in Lautoka and the surrounding towns to come down to Churchill Park on Thursday and join the march on World AIDS Day, and also visit the booths and find out more about HIV and the risks that are there.
Well, that's about all we have time for today. We thank you very much for your time. That was, of course, the Executive Director of the Rainbow Pride Foundation, Mr. Isikeli Vuluvo. Thank you so much for being on the show today, Isikeli, and we certainly look forward to having you next time on the show. Gold FM, only the classic hits. Mbuluvanaka, Fiji, and welcome back to Speak Your Mind. I'm your host for today's segment, Dion Vavu, and joining us in studio today, two members of the Citizens Constitutional Forum, the Chief Executive Officer, Bulutani, and of course, the Research Officer, Aman. Mbuluvanaka, gentlemen, how are you doing today?
Buluvanaka.
So glad of you to join us this afternoon and take time out from you two's busy schedules. Basically, jumping directly into the line of questions. What are human rights?
Dion, as building on from the conversation last week on the same program, human rights are things that we are born with and we are entitled to and we cannot live without. Things like our rights to life, rights to water, education, sanitation, not to be discriminated, and all these stipulated in the Bill of Rights in the 2013 Constitution, derived from the Universal Declaration of Human Rights that all UN member states they have recognized that rights instrument.
And Bulu, is there any hierarchy among human rights? Do certain rights take precedent over others, or would they be classified all in the same league?
They're all equal. That is one principle of human rights. There's no rights that we can say that are superior than the other. Or we can say that human rights to education is more important than the rights of women, or rights of women is more superior than rights to water and sanitation. Yeah.
And another thing have always been curious about is, are there differences between individual rights and collective rights?
There are, because taking for instance, our rights to, if you want to, our rights to expression, we want to express ourselves in a certain way. For example, if you want to shout, play loud music, but then we have laws that are there that define order in our communities at this particular time. These are the only places you can do that. Because going to the community or into a village or to a settlement, you cannot just come in and say things you want to say, because there are protocols that you have to follow. Yeah. And those collections of people or that community they have to respect the rights of the individual as well. That is where they interlink. Yeah?
I see. And Aman, a question for you, being the research officer. Would you say human rights depends on our culture?
Well, to some extent, yes. Because one of the fundamental challenges to to the propagation and fulfillment of human rights is also is indeed our culture and principles. But nevertheless, that is something that is decided upon by the the committee that says the United Nations the committees. They recognize they intend to decide if that if that if a particular human rights impinges on a culture, or on a particular a principle, or on a religious practice. But all in all, human rights they are they are a practice in totality inequally, because one has to recognize the fundamental fact that in its application it's human rights and they are bestowed to the human beings by virtue of by virtue of their birth as human beings and that is how those rights are bestowed to them. So by virtue of that those rights are fundamental and those form the central tenets by virtue of all individuals.
I see. And what value does a human rights approach I'll say that once more. What value does a human rights based approach add to the development of a nation?
Thank you. Now nowadays at the turn of this millennium, a lot of focus has been engineered towards towards development, and development is a human right. Development of a nation, many nations around the world, they have engineered and propagated the fulfillment of they are more they have more prioritized, let's put it this way, prioritizing the development as a center pillar, as a center aspect in the fulfillment and propagation of of human rights. Because nowadays development, I mean you mean the infrastructure, socio-economic rights, right to education, health, basic services. So all these rights which intend to benefit the citizens of a nation collectively. So and that is one of the fundamental reasons as to why the governments in many places around the world they are more tuned to fulfilling these rights and the development of the nations collectively. So that has been the central practice since the turn of this millennium.
Yeah, I think a new concept, not new, but something that is start coming up now is rights based approach to development, where all development or policies that are being designed, we must ensure that human rights place above everything else. When you talk about development, is such a big word. When you say some sort of any development that will be, for example, by the government, we have to ensure that people are consulted because they have their rights. They have to be informed. They should be given. They should give their consent, and those are the whole concept of all the part of the rights-based approach to development. It's something that Fiji really need to improve on.
Going on to our next question, how would you say Fiji is doing compared to the rest of the world in regards to our human rights situation and, as you say, taking a human rights based approach towards our development? Are we on par with the rest of the world, or?
We are making progress, Dion. One and foremost example is after 8 years under military ruling, we had the 2013 Constitution, which has the Bill of Rights. That is one progress, significant progress by Fiji, and we have policies that came up the last few years that protect and respect human rights. For example, the national policy on people living with disabilities. We have a national climate change policy. Other policies such as recently being still on the draft stage, like humanitarian policies. These and we have the UN. We have ratified the UN CAT, UN Convention Against Torture. So these are some of the examples that Fiji is making progress, even though there are a lot of improvement. There is still some areas that are needed to be improved by the state for the fulfillment and respect of human rights. That include the implementation of the Universal Periodical Review recommendations by other member states for Fiji to implement.
I see. Well, gentlemen, we'll cut to a short break before we do return. Thank you once again for joining us on Speak Your Mind. We'll be back after this short commercial break. Gold FM, only the classic hits. Mulavinak, and welcome back to Speak Your Mind. I'm your host, Dion Davu, and joining us in studio today, two representatives of the Citizens Constitutional Forum. Of course, the Chief Executive Officer, Bulutani, and yes, the Research Officer, Aman. Gentlemen, continuing with our line of questioning, what are the options available to those members of the public who feel their rights have been violated?
First, you can report their cases to CCF, and we can facilitate that to the Fiji Human Rights and Anti-Discrimination Commission. But we encourage our citizens who feel that their rights are violated to visit the Fiji Human Rights and Anti-Discrimination Commission. They are at Good Enough Street in Suva. That is Naimbati House, a few distance away just from Dolphin Eatery. I think most people will be aware of. And they're also running a project on in several police stations regarding people who are arrested by the police regarding their rights. And yeah,
I see.
that is a place they can go to.
And also, if, for example, I see that maybe somebody else on the street, their right is being violated, do I have any cause for concern rather to step in and see that another person's rights is being violated? Do I have any say in that if I see that happening?
Definitely, John. It is human rights come with the responsibility. It is very important that we also, while you claim your rights, you promote your rights, and you have to stand for the other person's rights as well. Like what you said is aligned to the 2016 International Human Rights Day. The theme stand for others' rights.
I see. And yes, moving on, coming up later on in the month of December, on the 10th of December, is the World Human Rights Day. Now, how long has that been happening around the world?
I cannot be definite with answer.
Is it been for maybe a couple of decades now, I'd assume?
I think yes. In like like when the Universal Declaration of Human Rights was promulgated on 10th of December 1948 by the United Nations General Assembly. So every year, there have been a set aside December 10th as a date for the International Day of Human Rights. So basically entails the human rights. So this year it will mark 66 years into the culmination of the human rights day since 1948.
Interesting. And what's the theme for this year's Human Rights Day, which is on the 10th of December, if I'm
Yes.
not mistaken? The theme for this year's Human Rights Day would be?
They stand up for someone's rights today.
So basically that question
Yes.
I was asking earlier, standing up for somebody else's rights.
Right.
I see. And also I was reading this pamphlet you had handed me earlier, this annual public forum. Could you elaborate a little bit more on that before we round up things for the day, Mbulu?
Dion, just going back to Human Rights Day, we are planning to have a march
I see, yes.
with a group of human rights advocates and the NGO Coalition on Human Rights, and with our communities as well on the 10th of December. There are some issues surrounding our permit for a march, but that will we look forward that will be resolved in the coming days. Aman will be the best person to explain
Aman,
on this. Yeah.
would you mind concluding our show for the day and just giving us a little bit on this Annual Public Forum 2016, which is a panel discussion on implementing the Bill of Rights?
Thank you, Dion. This Annual Public Forum is an annual event of the Citizens Constitutional Forum, whereby the idea, the general, like the fundamental idea is to create discourse, like the awareness, and deliberation on, like on creating awareness and discourse on areas surrounding the center around the Bill of Rights. So for this year, like we have come up with a theme panel discussion that we have been like organizing this week is on implementing the Bill of Rights, and like which is addressing the panel discussion theme is the Fijian Bill of Rights divisible. So essentially, like it will be like there'll be 4 panelists, like who will be like deliberating on the like who will be like we have drawn from respective fields, namely Mr. Ashwin Raj, Ms. Sharon Bhagwan Rolls, Honorable Mataya Kola, and Mr. Richard Naidu, who will be like giving the deliberations on like the discourses pertaining to the like theme that is like on the Fijian Bill of Rights. So like we are organizing this in like public forum at the this was the first time that that we have partnered with the Fiji National University, and we'll be organizing this forum at the FSM Pacifica campus, Extension Street, on this Friday, 2nd of December, from 6 to 8 p.m.
And that's open to all members of the
That
public?
is open to all members of the public. And the reason we have come up with this theme is that ever since Fiji's independence, largely the focus has been is on the fervent propagation of civil and political rights. Now I think some time ago we were discussing now that we have this the new concept of the human rights based development approach, the human rights approach development. Now that we have seen that the 2013 constitution entails a great deal in plethora of the socio-economic rights. So basically the panel discussion entails whether you can actually divide the very word itself, divisible, means can you separate it, can you divide it, or you cannot. So essentially that is what the panel discussion will entail. Can you actually divide the rights? No, it comes under the whole ambit, the whole scope, under the umbrella of human rights, or you can actually prioritize. So that will be essentially the theme we'll discuss and deliberate on. So like I mentioned, it is open to all members of the public, and we urge members of the public if you have the opportunity, please do come over and and learn about the discourses the discourse and the deliberations that will take place and the robust let's put that the idea is to promote a robust facilitation on this discourse.
Well, gentlemen, that's about all we have time for today. We thank you very much for your company, and we certainly hope that, yes, this Human Rights Day March does get off the ground safely. And of course, we thank you for joining us on Speak Your Mind this afternoon. For Gold FM, I'm Dion Lavu.